I'm relearning some important things like the precautions that you need to do, and one of the things I struggle with is which patients should I operate on. If someone's like morbidly obese with a BMI of 40, should I operate on that patient when I know there's a 20% infection? And there's evidence to show that I shouldn't, that the higher complication rate. Again, I don't want to not treat that person, and so that was kind of the thing that I was thinking about this morning that they talked about in the hip section. I certainly hope that orthopedics doesn't change much because I love what I do and I do it because I love it. The change that I can see happening though is just the electronic, to be able to maybe monitor patient range of motion at home on a computer, and it allows us to be more intimately involved on a daily basis in the patient care, and hopefully the result will be that the patients will do better. TOA is huge, and if I could actually grab every orthopedic surgeon by the collar in Texas and say, you need to do this and sponsor it. You don't have to come to the daily meetings or the yearly meetings, but the idea is the TOA is the hugest advocate for orthopedic surgeons. And so we keep all the other, we won't mention the names, yes I will, podiatrists, the chiropractors, the PAs, all of these people that are trying to do what orthopedic surgeons, everybody wants to be a doctor and they all want to diagnose, and the TOA has been critical in keeping them back, so not to expand their care because there's a certain limited amount of money and they're trying to get it. And so the TOA for that, and then just other regulations. The government's always tried to practice medicine. How many days do you need narcotics after a surgery? The doctor should make that determination, not necessarily the government. And the TOA is huge for doing that, and every orthopedic in the state benefits from that, but not everybody pays their dues, and that pisses me off.